Well, that was pretty remarkable. I appreciate Tank's work. I have to reciprocate and tell a story about Tank. Tank, by the way, is a nickname that was given to him as a child. Had something to do with the fact that he tended to go over things instead of around them. But Tank is the best surgeon I've ever operated with. And the story I'd love to tell about Tank is the first day of his fellowship. He did a case with Dave Tapper, July 1, and Dave came into my office at the end of the case and slumped down in a chair and said, "Oh man, it is going to be a long 2 years." And I said, "Geez, David, I mean, Brad Rogers, everybody at Virginia told us he was awesome." David says, "He is. I don't think we can teach him anything." That proved to be true. So I can't overstate the humility and the honor of being the president of this organization because it's meant so much to me. It's the one meeting each year that I'm resolute about attending. Devotion to this organization, it stems from its warmth, intimacy, collegiality that you see today, involvement of our spouses and partners, and the quality and the diversity of the scientific papers. When I became a member in 1992, I never anticipated being in this role and in the challenging position of trying to speak with you about something that might be interesting, provocative, educational, or novel. For me, there have been a lot of noteworthy presidential addresses at this meeting, and all by people whom I admire and respect. I can remember each of these addresses well. They always made me think, made me reflect, made me learn. And so it's with some humility and some apprehension that I choose to speak about something that might be considered extraordinarily non-surgical, and that is love. One of my favorite expressions to use when I'm operating with residents and they're trying to tie a suture and I'm trying to emphasize gentle technique, I often quip, "Now tie with love, not passion." And I can't credibly assert that I'm an expert on love. I think like all of you, I love doing surgery. I love providing care to patients and families. I love making patients feel better. I love teaching residents and fellows. And these are just some of the reasons that all of us chose this demanding career. We also hopefully all know the feeling of being in love, and Dr. Freischlag touched on the importance of that. I have the fortune of being in love with my wife, Julie, who's here. I also love my daughter, who's here, and Tank referenced her. But as I begin the later stages of my surgical career, I have the opportunity now to reflect on some ways that love, in all its aspects, contributes to my own personal joy, my successes, and enhances my professional life, or personal life, excuse me. So as a surgeon, an educator, and a physician leader, my attitudes about love in the workplace are a reflection of my own experience in each of these domains. And love has greatly augmented each of them. I want to make one thing very clear at the start. Love is more than a feeling, as shown here. It's action, just like surgery is action. Now, as surgeons, we're shaped by our mentors, our professors in medical school, our residency and fellowship faculty, our partners and associates. I think all of us can recall those virtuoso surgeons whose great technical skill and unflappable demeanor made us wonder, will I ever have that kind of skill? For me, there was the chairman of surgery at the University of Pittsburgh, where I was a medical student. Henry Bonson was a cardiac surgeon of extraordinary skill and unflappable demeanor. As a resident in Boston, it was Dick Wilson, who was a fearless oncology surgeon who always seemed to know the most subtle details of anatomy in every situation. And our chairman, John Manick, who was a vascular surgeon who was never slick and never fast, but whose operations were always perfectly planned, well exposed, and highly efficient. And here in Seattle, as John referenced, I've had the privilege to work with and watch several really gifted surgeons, especially my colleagues at Children's Hospital. And these technical lessons that I learned from them were crucially important in my training and in my aspiration to be a good surgeon. Now, those technical skills in surgery are sometimes the most obvious to us, especially early in our career. And while they are important, the skills of displaying love should be equally important. How do we define this love, and how do we learn these traits? Are there role models for this? Are these inherently nice people? Do they possess some gift or native talent? Is being a loving surgeon paradoxical and as rare and as difficult as, say, being a surgical scientist? Let's look at the skills and the characteristics of such individuals to see if we can understand and all strive to be great at surgical love. So the love I'm talking about now relates to the ancient Greek term agape. And this is a deep spiritual love that's characterized by compassion, empathy, understanding, and openness. So undoubtedly, if any of us were patients suffering from illness or injury, these are the characteristics that we would want exhibited by our physicians. But as surgeons, we're often characterized as lacking such traits. So much so that there's the cliched assessment of us, well, he can be a bit abrupt, or she doesn't have the greatest bedside manner, but she's a superb surgeon, as though the two skill sets are mutually incompatible. Some of us might feel defensive of that characterization and assert that, hey, we work harder than any non-surgeon, and we have made considerable sacrifices for ourselves and our families, and it's because we care so much about our patients and our service to others. Some of us might even say, well, look, I'm a quiet, private person, and I cope with the severe illnesses that I face daily by remaining emotionally neutral. Some of us might even say that separation of emotion is required to maintain cool, level-headed focus in the heat of the battle. But I'm going to assert that love can make us better surgeons, better physicians, better teachers, better team members, and better family members. Now, Dr. Scott Deering is an emergency room physician who wrote Love Your Patients, a book that explores this aspect in some illuminating detail. Dr. Deering asserts that while agape love is a feeling, there are actually specific actions that demonstrate love to others with whom we interact. So from the perspective of our patients or our colleagues or our own families, these actions are actually more important than how we might feel. Furthermore, Dr. Deering presents a case that one can learn these actions and behaviors, and that through practice of these behaviors, you can actually develop the feeling of agape love. His big three behaviors of love for us to develop, especially as caregivers, are compassion, respect, and humility. Now, like any skill or action, these require some intention and practice. So surgery is very demanding of us. It frequently requires that we put our patients and their needs ahead of our own families. Our spouses, our partners, our children, our friends, they all can no doubt recall the dinners delayed, the concerts, the plays, the athletic contests missed, the family events from which we were absent. And all of us are quite aware of the hours of sleep sacrificed to serve our patients and the toll that that can exact from us. So are not these actions signs of devotion to our patients, and aren't they a sure sign of love? Well, yes, they are. And many of our patients realize and appreciate that. Many of our patients have expressed their thanks for our late night rounds or weekend rounds or our after hours phone call, for answering some questions or concerns they might have. Yet, unfortunately, we seem to struggle to convey love, that is the actions of love, to the patients and our colleagues in our everyday interactions. So some of us might respond, look, I already give to my patients as much as I can. It taxes me so much, I have no capacity for anything more. And besides, I can't become emotionally attached to my patients. Well, paradoxically, A recent Associated Press survey done in conjunction with the University of Chicago shows that patients' perceptions of quality actually suggest that these behaviors that demonstrate love are what our patients want, even more than technical or intellectual prowess or decision making or quality as measured by outcomes metrics. Now, as Dr. Waldhausen referenced, I'm a firm believer in quality improvement and doing everything we can to incorporate safety into everything we do for our patients. But this survey would indicate that American patients want their physicians, and I suspect Canadian patients as well, would really want their physicians to consistently demonstrate the behaviors of active listening, warmth, and the ability to communicate effectively. They care substantially less about surgical site infection rates, DVT rates, length of stay, and quality metrics that we know as physicians are important. So my first role model of surgical love was a professor of surgery at the University of Pittsburgh. His name was Charles Watson. He was a very proper, erudite guy, wore bow ties all the time. He specialized in biliary and endocrine surgery. Dr. Watson was a very demanding teacher, a master of the Socratic style. When you scrubbed on a case with him, you had better know everything about the anatomy and the physiology of that disease. He also made rounds every afternoon on all his patients with the residents and the students. And while he would again use the Socratic method to explore all aspects of surgical disease with us, he then gave his full and total attention to the patients once he entered their room. He was the first surgeon I witnessed who always sat down in a chair next to the patient's bed. He conveyed the impression that he had all the time in the world for them, and he was notably genuine in the concern for his patients. He always knew something about their lives in addition to their disease, inquiring about those details regularly. He would patiently ask them for questions or concerns, and he never made them feel as though he was rushed, but rather that he cared for them. So during these rounds, he was in essence ministering to his patients. He was teaching us an extraordinary amount of science and anatomy and pathophysiology, and he left all of us with this incredible feeling of warmth, of love, that he cared for each of us at some very basic human level. He had compassion, not just for his patients, but also for his trainees. I recall one episode when we were on rounds, and he had to tell a patient on whom he'd operated that her pathology had unexpectedly revealed a malignancy. He told her in such a warm, sensitive way, literally holding her hand, and acknowledged her fears without dismissing them. She was very tearful and expressed her concern about how she was going to tell her husband. This extremely busy surgeon offered to call her husband right then and there, or to return after finishing the rest of his rounds to sit and talk with her and her husband when he came to visit. I have no doubt that she probably remembered nothing about the medical information that was conveyed that day, but probably remembered for the rest of her life the way Dr. Watson made her feel on that day. His actions clearly conveyed caring and compassion. Now, in addition to our professors and mentors, our patients can teach us a great deal about love if we're willing to pay attention and listen. When I was a third-year resident in the emergency room, there were two patients who taught me some valuable lessons about humility and respect. One was a woman who was a Christian Scientist, and she had sustained a pretty significant head laceration at work, and her work colleagues had brought her to the ER. I examined her and determined that she needed some local anesthesia and multiple sutures and probably a several layer closure. She politely but firmly declined my pretty emphatic insistence that this be done. And she explained that such medical treatment was not necessary and that through assistance from her church and prayer, she would be fine. I was pretty indignant. I made her sign out against medical advice, and went on with the rest of my night in the ER. Several days later, the charge nurse called me to the front to speak with a patient who'd asked for me by name. It was the Christian Science patient. She wanted to show me that she'd gone to church. She had received some assistance from a church member who tied her hair in a way to reapproximate her scalp, and she'd been praying, of course. I was frankly astonished to see how well it was healing. She told me how much she respected my expertise, but also asked me to be open to the possibility that faith and non-medical therapies could still be of value to people with injury or illness. She showed great respect for me, and I learned some humility and some respect for the beliefs and opinions of others. Hers was really an act of love, a remarkable act of love, considering that I had been pretty judgmental during our first encounter. Another night in the ER, about 4 in the morning, things were slowing down a bit. I saw the opportunity to go lie down for a little nap, and I was awakened 10 or 15 minutes later to go see a woman who presented with a fairly routine gynecologic problem. Allowing my fatigue to be exposed, I questioned her decision to come into my ER at 4 o'clock in the morning for such a routine problem. She looked at me and said that she and her husband were both working 2 jobs. They had 3 young children, and her husband was currently home with those 3, and that this was therefore the only time and the only place where she could get medical care. The sincerity and the details of the chaos of her life stirred some feelings of compassion in me, and it taught me a valuable lesson that we ought to be trying to listen to our patients and understand their lives as much as possible. Now, as surgeons, we meet patients and families when they're experiencing extraordinary stress. And not surprisingly, some of them are at one end of the spectrum, and they get labeled as difficult patients or difficult families. They're seen or described by the residents and nursing staff and our colleagues as demanding and excessively needy. Why is it that some of our colleagues seem to have more than their fair share of such patients? I don't think it's they're gluttons for punishment. I've concluded that it's because these surgeons have developed an ability to display love. These surgeons seem to be able to communicate the same information, the same difficult messages, set the same expectations as their peers, yet they're able to do it in a way that makes patients feel better. So these loving surgeons, they listen patiently, they use facial expressions of empathy, they begin their communication with acknowledgement of the patient's concerns. So for example, such surgeons might say, "I'm so sorry to hear that you're having pain, and I know that getting out of bed after a colectomy is hard. We need to work on improving your pain medication and get you out of bed today so that you don't get pneumonia or form blood clots." The rest of us, hurriedly making rounds, trying to see as many patients as we can before going to the OR or the office, might deliver the same message by saying, "Now today we need to get you out of bed, even if it hurts a little bit, because we don't want you to get pneumonia or blood clots." Now both messages contain the same essential information, and they take about the same amount of time, but the first really makes people feel better than the second. Surgeons who demonstrate love attract patients who need more love. And this reminds me of an aphorism that one of my pediatric surgery mentors, Dale Hall, told me. He said, "In order to be a good, busy surgeon, you need patience, and it doesn't matter how you spell it." Now, many of our patients are nervous, even afraid when they present to our offices, or especially in the pre-op area. Yet how often do we actually ask them, "Are you feeling afraid?" Imagine the connection that you could make with a patient or the patient's loved ones by simply asking them if they're afraid or nervous. If they respond in the affirmative, you're presented with a wonderful opportunity to connect with them in a very deeply personal and emotional way. Again, an acknowledgement of their fear, a reassurance that such fear is normal, and that you will do everything in your power to take care of them. These are all expressions of love and respect. In my practice of pediatric surgery, I have tried to end conversations with parents by telling them that we'll treat their son or daughter like our own child. These verbal habits, coupled with facial expressions of concern, are behaviors of love that truly can make people feel better. And after all, doesn't it benefit all of us if our patients feel better and are relaxed? I was once asked by our staff oncologist to place a Hickman line on a little boy with a large abdominal neuroblastoma. And in my pre-op session with the parents, I could tell they were absolutely blown away, in shock about the diagnosis. And they were frankly, I asked them, and they were frankly afraid that their son was going to die. I told them that I understood their fear. I told them that we would take great care of their son, just like he was one of our own, and that I viewed putting this Hickman line in as the first step towards him getting better. Well, thankfully, many months went by. He responded well to chemotherapy, and I had the opportunity to resect his tumor after it had gotten substantially smaller. I met with his parents before the tumor resection. His mother took the time to tell me that she remembered fondly our first meeting, which I found remarkable since it had been at such a stressful time. But she said that I'd made them feel loved and that I'd given them their first sense of hope. Now, some of you might be thinking, this just isn't me. I'm not a touchy-feely person. I can't see myself asking people about their fears, and I can't give any more than I already give at work. Again, my humble assertion is that when we give love to those around us in work, everybody wins. We inspire our teams to work better, our patients will be happier and they'll do better, and we'll therefore feel better about our work. We'll be happier, and our family lives and our friendships will improve. Remember, surgery is action. Love is action. The first step is to behave with love, and ultimately those behaviors will lead to you feeling the love. What about love as an educator? You know, for many of us who have the privilege of training residents and fellows, they become our surgical offspring, our children, if you will. We're proud of their progress during their training, and we take parental pride in their subsequent accomplishments. So as educators, we're always on display. We're role modeling our behaviors constantly. Trainees are more likely to do as we do than as we say. So demonstrations of behaviors of love are more compelling to our trainees than the lessons we might profess in a lecture or at Morbidity and Mortality Conference. As I mentioned earlier, the impact of my mentors in the early part of my career stays with me to this day, and I've learned a great deal about watching how they treat others in their communications, even when they're in stressful situations. When such skills that demonstrate love for our patients and our colleagues are so important to them, why is it that we don't teach our trainees these skills? The same way we teach them the nuances of GI physiology or adrenal physiology and anatomy. Now, while some medical schools have tried to incorporate this vitally important aspect of teaching into their curricula, we typically pay very little attention to this in regard to surgical care. We expect our trainees to read surgical textbooks and journal articles, yet we rarely ask them to read or learn about things like crucial conversations. Like many of you, I've over the years received many complaints from nursing staff or patients or families about surgical residents. Often the facts, as they're labeled, are in the conflict or are disputed. And there's a great tendency to take sides based on the purported facts. All things being equal, if that resident hasn't been in trouble before, I'm more likely to side with the resident. Many times we've had the conversation like, yes, you were right, this patient did not need Lasix. But sometimes I've even just said to them, look, just go apologize to them and that'll be the end of it, right? Well, often the key element of that conflict was not the disagreement about what the patient needed per se, but rather it was the failure of the young physician to recognize and acknowledge the validity of the other person's opinion. Imagine the power of coaching a resident on how to disagree with a colleague or a patient, yet in a validating and respectful manner. We would have, wouldn't we, a very strong major teaching moment? And imagine if we could demonstrate for him or her expressions and phrases that could diffuse conflict. We'd be love coaches. Now, really reminds me that coaching such behaviors is feasible, and there's no doubt, I think, about the value of coaching for us as surgeons. Atul Gawande made this case in his 2011 New Yorker article, offering that even those of us who are fairly far along in our careers can improve our performance as surgeons. But there's little written about coaching interpersonal skills or behaviors that display love by surgeons. There are programs that many of you may be aware of, provided by consulting companies that focus on some of these behaviors, the goal being to improve the patient experience. And there are many healthcare organizations that require such programs. Unfortunately, physicians, especially surgeons, are frequently less than enthusiastic participants. I've heard some facetiously referred to such programs as Be Nice to Your Patients class or charm school. But if our goal as educators is to train the best surgeons, the best physicians that we can, and for us to be the best surgeons that we can be, our patients would tell us that they care less about how slick we might be as technicians and much more about how we make them feel. How about in leadership? Well, surprisingly, there's only a few books that specifically address the requirement, the advantage of using love to be an effective leader. There's a creator of an innovative financial organization called Operation Hope, John Bryant, who asserts in his book, Love Leadership, that there are really only two ways to lead, with fear or with love. He makes the case that while both can be effective in the short term, only leadership through love can result in lasting success for a team or an organization. Joel Manby, who's the CEO of Hirshon Family Entertainment, wrote a book, Love Works, where he describes the 7 principles of effectively leading with love. These principles are: be patient, have self-control in all situations, no matter how difficult. Be kind by showing encouragement and enthusiasm. Be trusting. Place confidence in someone. 4, be unselfish. 5, be truthful. 6, be forgiving. Let go of grudges. Give people a second chance. And finally, be dedicated to your values. I find it significant that this list sounds very familiar to all of us, whatever our religious orientation, because virtually every religion in the world has similar tenets. And all of us can agree that these principles could be successfully practiced by us as surgical leaders. Dave Tapper, John referenced our pediatric surgery mentor and my first partner and boss, was a surgeon who always demonstrated compassion for patients and families and with all the people with whom he worked. He was a gifted technical surgeon, that can't be understated. But more importantly, David seemed to know everyone and know something about them. He made everyone around him feel good about themselves and aspire to be better. Many of us here can attest to his effectiveness as a leader. He sadly left us way too early. A few years ago, I had to clean out some files in our office as we were moving our offices. And I had the bittersweet opportunity to go through some of David's files, including a large file of correspondence. What absolutely astonished me was the volume of correspondence devoted to promoting other people's careers. He supported surgeons from all over the United States, many of whom he had not directly trained or worked with. I was absolutely awed by the effort that he made for many of us right here in this room. And reading all these letters and notes, I realized that David must have spent time almost every day asking himself, how can I advance others' careers? These were selfless acts, leadership acts of love, demonstrating many of the features on the screen: encouragement, trust, and a dedication to his values that he wanted people to reach their optimal performance and personal happiness. Now, I want to clarify that leading with love does not mean that one has to be soft or a pushover. On the contrary, I think an effective leader who leverages love can more easily set clear expectations and accountability, and thus be more effective in holding people to those standards. So Coach Mike Krzyzewski, the demanding and remarkably effective basketball coach of Duke University and now coach of the United States national team, holds his athletes to a very high standard of consistent excellence. And he describes this approach in a book of his on leadership called Leading with the Heart. Such a loving leader is more likely to have sustained success like Coach K does, as opposed to his peers who all too frequently use fear to motivate young athletes. So how to be a loving surgeon? What can we do to learn these actions of love? Several things. First, I'd say start with learning the valuable behaviors that convey love. Read Crucial Conversations, a wonderful, fairly short, but powerful book that addresses how we interact with patients during times of stress, and certainly providing surgical care qualifies as one of those times. Love Your Patients is another worthwhile read. It's focused on issues specific to medicine, issues that we face as physicians, and it gives good examples of love behaviors that can apply directly to patient care. Don't stop reading these things, just try it. Try these behaviors. If you don't get it perfectly, it's okay. Your intention combined with your effort will have a positive impact. Now, for those of you who are maybe experiential learners, I'd ask one of your associates who's known for his or her bedside manner if you can make rounds with them. Watch their nonverbal communication, their posture, their facial expressions. Pay close attention to the words they use and how they use them. Ask him or her to then make rounds and watch you and give you feedback. Remember, we're never too old or too good to improve. Now, for some, this will not be easy, but the effort will be worthwhile, I'm certain of that, both for you and probably for your coach as well. Finally, and perhaps my most compelling recommendation, is to develop or enhance the feelings of love in your workplace. So while compassion is a behavior, it can be learned and practiced. Empathy is the feeling of compassion for another human being. It's a deeper expression of love. So as I mentioned, there is some evidence that the former begets the latter. Try to remember the idealism that spurred us all into a medical career. It is, after all, what we're all about. We want to help people, and we want to make them feel better. Try to consider how we would want to be treated if we were patients, if we were our colleagues, if we were one of our hospital team members. For those who have not seen a video, I'm going to have at the back of the room a list of some of these books in this video link. There is a video about empathy from the Cleveland Clinic that I encourage you to watch. It's powerful, has a message that I guarantee will touch you and awaken the feelings that we sometimes bury in the name of surgical efficiency and objectivity. It reminds us that the people with whom we work, the patients for whom we care, and the people we encounter during our daily routines, they all have stories to tell. And if we can learn some of their story, if we can connect with them in that very human way, we're showing our love for them. And you're potentially helping heal them just as much as surgical skill might. So I want to thank you for allowing me the privilege to present my thoughts about something that is important to me. It has contributed to my personal and professional happiness. It's still a journey for me. I am far from perfect in the practice of love. I am confident, though, that those who practice surgery with love are having more fun. They're happier than those who aren't. And I'm equally confident that all of us can learn to show our compassion, to show our patients and colleagues that we love them, and that we'll all be happier and more effective surgeons as a result. So I leave you with my favorite aphorism: tie with love and save some of the passion for home.